Hello friends, welcome to Knowledge Bytes. Friends, today I am going to teach you about the mitral valve prolapse. Just look upon these two photos. This is the first photo which is showing the normal left side of the heart, and the second photo is showing the abnormal left side of the heart. Why the first photo is normal left side of the heart? Because I want to compare these two photos, and in the first photo you can see that the mitral leaflets are normal placed and they close evenly and smoothly. But in the second photo you can see that there is upward bulging of the mitral valve. This upward bulging of the mitral valve is known as mitral valve prolapse. So why this upward bulging of mitral valve has occurred? Mitral valve leaflet has occurred. Is pathology lies in the mitral valve leaflet? The answer is no. The pathology does not lies in the mitral valve leaflet, but the pathology lies in the fibers which is attached to the mitral valve leaflets and the papillary muscles. These are the papillary muscles, and these are the fibers which are attached to the papillary muscles and the mitral valve leaflets. So this fiber is known as chorda tendineae. Chorda tendineae. Now what will happen if mitral valve prolapse has occurred? The blood which is present in the left ventricle will now reach to the left atrium, and therefore there will be extra amount of blood which will be present in the left atrium. The extra amount of blood will lead to the increase in size of the left atrium, which will lead to the hypertrophy of the left atrium, and when the hypertrophy of left atrium occurs, this will lead to arrhythmia, atrial arrhythmia, and this will lead to hypotension. And you can see the pathology lies in the chorda tendineae muscles. I have told you about that, and there will be stretching of chorda tendineae muscle, which will produce a sound which is known as mid-systolic click. The sound is known as mid-systolic click. The chorda tendineae muscle is stretching, which is producing stress on this papillary muscle, and because of the stress produced in the papillary muscle, ischemia will develop in the papillary muscle. Ischemia in papillary muscle, or in the muscles subendocardial area muscles, the ischemia will develop, which will lead to arrhythmia. Now this ventricular arrhythmia can lead to sudden cardiac death. Now I want to discuss the one-liners. Most common cause of mitral regurgitation is mitral valve prolapse. Now in the same question, if it is written most common cause of mitral regurgitation in India, then the answer will change and the answer will be rheumatic heart disease. If the question says what is the most common cause of mitral regurgitation, the answer is mitral valve prolapse, because mitral valve prolapse is the overall most common reason for the mitral regurgitation. But if the question specifically says that what is the most common cause of mitral regurgitation in India, then the answer will be rheumatic heart diseases. Now what are the causes of this mitral valve prolapse? Causes of mitral valve prolapse. The causes of mitral valve prolapse is, the first is the idiopathic. The second cause is myxomatous degeneration of the valve tissue. Myxomatous degeneration of valve tissue. There is the collagen defect, type 3 collagen defect. Because of the type 3 collagen defect, the chorda tendineae function gets compromised and there is the upward bulging of the mitral valve. The third cause is the Marfan syndrome. Marfan syndrome. In the Marfan syndrome patient, you can see there is the increase in the size of the fingers. This is known as arachnodactyly. Arachnodactyly. Here is the chromosome 15 defect, and because of the chromosome 15 defect there will be the abnormal protein synthesis, the abnormal fibrillin 1 protein defect. The fourth cause is Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. This Ehlers-Danlos syndrome is also known as rubber man syndrome because there is stretching of the more stretching of the skin than normal. The fifth cause is osteogenesis imperfecta. Osteogenesis imperfecta. The sixth cause is straight back syndrome. In straight back syndrome, the anteroposterior diameter of the chest decreases. When the anteroposterior diameter of the chest is decreased, then the function of the heart will also get decreased. It may so happen that mitral valve prolapse can occur because of the decrease in the anteroposterior diameter, which is known as straight back syndrome. The other causes are the rheumatic heart diseases, dilated cardiomyopathies, infective endocarditis, or it may happen that the patient is suffering from ostium secundum ASD. Now the patient who is having mitral valve prolapse, then this patient will have coaptation defect, abnormal closing of the mitral valve leaflets will lead to the coaptation defect. There will be more strain in the papillary muscle. I have told you that ischemia will develop in the endocardium. Ischemia of endocardium of the left ventricle. The ischemia will lead to the ventricular arrhythmia, which the patient can have sudden cardiac death. Now the patient suffering from mitral valve prolapse, what will be the clinical feature the patient will represent to you? The mitral valve prolapse is more common in female than male, and the age group of such patients are 15 to 30 years. This is the young patient, and in term of young patient we don't think of the vascular diseases in such patients. The patients most commonly the patients are asymptomatic. The symptoms which presents to you are the chest pain, and to chest pain patients we think that the ulceration of the stomach is happening, so we are giving the drugs such as pantoprazole or Digene, but the patient is having recurrent chest pain. Patient also tells that he feels palpitation, and patient also have syncopal attack. Then we may think that the patient is having any of the neurological problems or psychiatric illness. When we rule out these and we do the ECG of the patient, then we get the broad QRS complex, which shows that there is premature ventricular contraction or ventricular tachycardia is occurring to such patients. Patient may also have transient ischemic attack. The clots may get lodged in the vessels which is present in the brain and will lead to any of the organ function gets compromised. Lastly, the patient, if having mitral regurgitation, in the later stage the patient develops the mitral regurgitation, the patient will have left atrial congestion, and this left atrial congestion with pulmonary edema, because left atrial congestion will lead to the pulmonary edema. Now, what are the auscultatory findings of the patient of mitral valve prolapse? Auscultatory finding. There will be two findings. The first finding is mid-systolic murmur. I have told you why this mid-systolic clicks. I have told you why this mid-systolic clicks occur. This mid-systolic clicks occur because of the stretching of the chorda tendineae muscles. And in later stage, the patient may have late systolic murmur. Now, why this patient is having late systolic murmur? The patient is having late systolic murmur because of mitral regurgitation. The blood from the left ventricle is going back to the left atria. That is the mitral regurgitation, which is the late complication of the mitral valve prolapse. One thing more I want to tell you, that if the posterior leaflet is involved, then the pain radiates anteriorly to the base of the heart. And if anterior leaflet is involved, then the pain radiates to axilla and back. Okay, now the mitral valve prolapse is inversely proportional to the size of the ventricle. The mitral valve prolapse is inversely proportional to the size of the ventricle. If the size of the ventricle is more, then the patient is having less chances of having mitral valve prolapse. But if the ventricle size is less, then the patient has more chances of mitral valve prolapse. Now we are to the end. So the things which I am going to tell you are the changes in murmur on standing and squatting. Changes in murmur on standing and squatting of the patient suffering from mitral valve prolapse. On standing, the venous return decreases. Because of that, size of ventricle will decrease, which will lead to the increased chance of prolapse, we can get the mid systolic click early mid systolic click we will get. But if the patient is squatting, there will be increase in venous return, therefore size of ventricle will increase. Therefore there will be the decrease in chance of mitral valve prolapse. Then we will get late mid systolic click. Okay, now the last thing which is left is the treatment. But before treatment, one thing more, that is, what is the investigation of choice to such patient? The investigation of choice to these patients are transthoracic ECG, we can also do echocardiography. To such patients, and in echocardiography we can see that there is upward displacement of the mitral valve to more than 2 mm. Upward displacement of the mitral valve to more than 2 mm. Now the last thing which is left is the treatment part. Treatment of mitral valve prolapse. The patient of mitral valve prolapse may develop infective endocarditis. So for prophylaxis we are giving antibiotics to treat infective endocarditis, or we have thought that the patient may have developed infective endocarditis, so we are giving antibiotics for prophylaxis. We have to decrease the function of the heart, we have to decrease the oxygen demand of the blood, so of the heart, then we are giving beta blocker. Because of that, heart rate will decrease and this will decrease the chest pain. We are also giving anticoagulants. These anticoagulants does not allow an arterial fibrillation to occur, prevents arterial fibrillation. Anticoagulant prevents arterial fibrillation. Or if no of these are helpful, then we are doing mitral valve mitral valve repair, or which is known as valvuloplasty. So these was all about the mitral valve prolapse. Hope all of you just enjoyed my videos. Thank you.